sure many of our viewers today are wondering who the therapy is right for and when is it most appropriate in the course of myeloma. Could you address that?
Yeah, absolutely. So currently, you have to have had 3 prior lines of therapy with drugs such as a CD38, which is a daratumumab is the name of a medication. You have to have a drug such as lenalidomide, as well as a drug like bortezomib. And you've had to have had 3 lines of therapy. So that's how you can access the therapy. But if you're willing to participate in a well-designed clinical trial, there are studies with CAR T-cell therapy earlier on. So one of the things that we're advocating in the myeloma world is clinical trials. We haven't gotten to where we are in 2024 with the advances in science, the advances in living longer and living well with myeloma without the brave people before us that have participated in clinical trials. So people who it's right for would be if they qualify for a clinical trial before their 3rd or 4th line of therapy, or if they've had 3 or 4 prior lines of therapy.
Yeah.
And there's other points to that, which I'm sure we'll talk about later on.
In your opinion, what are 3 key considerations that myeloma patients and care partners should think about related to the CAR T-cell therapy approach?
Oh gosh. Well, I would like to say I always, when you're selecting a therapy, think of the physical, the financial, and the social implications of that therapy. So physically, is the medication too strong for you? Are you too weak to take it? Or is it just right for you? So finding the right medication for the right patient at the right dose at the right time. So the physical component, the financial component is also very important. So maybe your insurance now won't cover it, but then there's open enrollment in Medicare towards the end of the year, or you can find financial support reimbursement through many of our generous organizations that will provide grants for certain medications. And then the social, do you have a care partner? As we discussed, the importance of being monitored for 30 days. If you don't have a formal care partner, is there some system that we can help support you through so that you can have the different supports throughout? But it's not only that beginning part where you're gaining the information, and I think of it like a timeline. The beginning part, you're thinking about and gathering information in that process of getting your cells back because of the side effects, which I think have been talked about in a prior webinar. And then the post monitoring where you go back to your community, take antibiotics, antiviral medications, et cetera, to keep you living well longer. So it's a process.
Well, it's great advice, Dr. Faiman. Thank you. And I'd also like to add that if you're considering CAR T-cell therapy, the Patient Empowerment Network has a wealth of information on this topic, including resource guides and interviews with experts like Dr. Faiman. And you can find those at powerfulpatients.org/myeloma.